Major depression is diagnosed using the DSM-5. Patients must experience either a depressed mood or loss of interest and pleasure present most of the time nearly every day within a 2-week period. A useful mnemonic to remember the symptoms is SIG-E-CAPS. Issues with sleep, lack of interest, feelings of guilt, fatigue, concentration deficit, change in appetite or weight, psychomotor retardation or agitation, and possible thoughts of suicide.
The responsible mechanism of depression is unclear. However, there are biologically based theories proposed to explain this phenomena. The monoamine hypothesis is the most prominent and heavily researched theory. It claims that the deficit of certain neurotransmitters is responsible for the corresponding features of depression. Another consistent research finding in major depression is the hyperfunction of the HPA axis. This is characterized by overstimulation of corticotropin releasing factor, reduced negative feedback, and hypercortisolism. S-adenosyl L-methionine, or SAMe, was first discovered in 1952 and is formed from the essential amino acid methionine combined with ATP. SAMe is a naturally occurring molecule found in every living cell, where it functions as a donor of methyl groups in over 100 different reactions catalyzed by methyltransferase enzymes. SAMe's exact mechanism of action is not clear, although it has been theorized that the stimulatory effect it has on neurotransmitters is the mechanism underlying its antidepressant effects. Treatment increases cerebrospinal fluid concentrations of 5-hydroxyindole acetic acid, the main metabolite of serotonin. In addition, through the stimulation of phospholipid methylation, SAMe could also increase the fluidity of cell membranes. It has consistently shown that it performs on par with TCAs and SSRIs for the treatment of depression. A Cochrane meta-analysis showed it was superior to placebo when used in combination with SSRIs. However, there was no significant difference in terms of effectiveness between SAMe and placebo alone. The exception was that fewer participants experienced side effects when treated with SAMe compared with TCAs.
Let's focus on other nutritional interventions. Chromium picolinate is indicated for patients with atypical depression and carbohydrate cravings. A diet with too much white flour and refined sugars can deplete chromium. A third of depressed patients have folic acid deficiency. Deficient patients are 6 times less likely to respond to treatment, and their depression is likely more severe. Taking folic acid may help patients who are unresponsive to antidepressants. Screen depressed patients for their red cell folate status, since some people require a higher dose, and check B12 levels to avoid masking anemia due to B12 deficiency. In terms of B vitamins, people with higher serum B12 levels had better response to their medications and were more likely to recover. In addition to methylcobalamin, taking a B complex, 50 or 100, with vitamin C, calcium, magnesium, and zinc is beneficial. There is less depression in societies with high fish consumption, and depressed patients have lower red blood cell omega-3 levels. Supplementing with omega-3s can reduce depressive scores. In a review of 16 trials, there was no dose-response relationship or difference in terms of efficacy between EPA and DHA, but other studies have showed EPA is responsible for the antidepressive effect. There is a theoretical risk of bleeding, but there is evidence that this doesn't occur. Tyrosine is a precursor for norepinephrine and dopamine. It's best used for patients with both depression and fatigue. 5-HTP is an amino acid precursor to serotonin. Use caution when combining it with mainstream antidepressants and St. John's wort. There's a link between vitamin D insufficiency and depression, so assess baseline 25-hydroxy vitamin D levels to determine the optimal dose.
The oral therapeutic dose of SAMe is between 200 and 1600 milligrams per day, and the parenteral dose is between 200 and 400 milligrams. If SAMe is taken orally, it should be administered in divided doses and taken on an empty stomach for best absorption. The cost of SAMe is around $70 per month, which is comparable to new age TCAs. However, the side effects associated with SAMe are milder, and the beneficial effects are noticed much quicker than these medications. Therefore, SAMe is safe and effective treatment.